Here's your host for this morning's edition of America's Fabric.
Good morning. I'm Dr. Elizabeth Lee Vliet. I am an independent physician in private practice in Tucson and Dallas and the author of several books for consumers. My medical websites are www.herplace.com and www.internationalhealthstrategiesltd.com. Today, I will be talking about gun control and healthcare control. At heart, both are people controls and infringe on constitutionally guaranteed liberties. But first, I thought I'd share with you an interesting statistic that I was sent about a week ago. The number of physicians in the U.S. is 700,000. Accidental deaths caused by physicians, 120,000 per year. Accidental deaths per physician actually translates from the total of 120,000 per year to per physician 0.171. Those statistics are courtesy of the U.S. Department of Health and Human Services. Now, think about this. The number of gun owners in the U.S. is 80 million. The number of accidental gun deaths per year in all age groups is roughly 1,500. That makes the number of accidental deaths per gun owner 0.0000188. Statistics courtesy of the FBI. So, statistically, doctors are approximately 9,000 times more dangerous than gun owners. And the fact is, not everyone has a gun, but almost everyone has at least one doctor. This means you're over 9,000 times more likely to be killed by a doctor as a gun owner. Does this mean that we should now have the Senate focusing on banning doctors before this gets completely out of hand? On a more serious note, as a physician, I have been involved in the fight to preserve medical freedom and privacy and the right to use our own money to pay for medical services we need or decide to have. Given that we know that guns can kill or maim, some might think it odd that as a physician and defender of patients' lives, that I would also be a strong defender of the Second Amendment that says the right to keep and bear arms shall not be infringed upon. But it's not odd at all. Consider that our bodies are our most personal of property. British philosopher John Locke, who greatly influenced our founders, taught that each of us has the unalienable right to own our bodies. The right to life means we have the right to control our bodies and the right to defend our bodies when threatened with harm. From John Locke's belief that we own our bodies comes the next step in his ideas, upon which America was founded, that we are each endowed by our Creator with the unalienable right to life, liberty, and the pursuit of property. When our Declaration of Independence was finalized, the word property was changed to the pursuit of happiness, which conveyed the very personal nature of the pursuit of property. Our bodies are the most personal property we own. It's our choice whether to take care of our bodies with exercise, healthy eating, proper rest and relaxation, moderation in the pleasures we pursue, and medical checkups. It's also our choice to abuse our bodies by overeating, overdrinking, overstressing, overuse of drugs, or missing our checkups. The next step in this logic is If we own our bodies, we also control our bodies, which means we also have the right to defend our bodies. The right to defend our bodies, to survive, to have life, in turn is the foundation for the idea that we have the right to keep and bear arms. You cannot defend yourself with a piece of paper. Or, as a politician recently suggested, women should resist attackers who are armed with guns by using a ballpoint pen to poke them. Give me a break. Just as access to the right type of medical care when we need it means we may live longer, access to firearms when we need them to defend ourselves also preserves our freedom to live. When the federal or state governments control who can have medical care, who has access to what medical services, as well as who can keep and bear arms, both types of control deprive individuals of their most fundamental and God-given right, the right to own and defend our own bodies. Defenders of the right to bear arms acknowledge that firearms are designed to kill a predator, whether man or beast or government seeking to take away one's life. In fact, it was to protect against government taking over our lives or killing us that led our founders to enshrine the right to keep and bear arms as the Second Amendment to our Constitution. No one doubts what guns can do when the holder of the firearm has malevolent intent. But that said, the Second Amendment has nothing to do with having a weapon to go hunting for sport. The Second Amendment has everything to do with defending our property and our bodies as property against government takeover or control, or from criminals who don't obey gun laws anyway. The Second Amendment to our Constitution that was ratified by the states reads, quote, "A well-regulated militia being necessary to the security of a free state, the right of the people to keep and bear arms shall not be infringed." End quote. The words are very clear. The right of the people, men and women, shall not be infringed. Yet the radical gun control group has become unhinged since the Sandy Hook shootings. Politicians who do not agree with our founders' view have proposed extreme gun control measures that would basically ban all firearms except revolvers and would institute a house-to-house search for weapons. This is exactly what our ancestors fought against when King George was oppressing them. The key question we should be asking is, who in society gets to have the weapons? Only the government? Only law enforcement? Only criminals who don't follow gun laws anyway? Or shall free men and women be trusted to keep and bear arms as our founders intended? The question is not, why do you want an AR-15? The question we should be asking, if I'm a law-abiding citizen, why do you not want me to have one? The U.S. government just sent fighter jets to arm the Muslim Brotherhood that now controls the Egyptian government. Yet the U.S. government does not trust law-abiding citizens to keep and bear arms? That is the antithesis of what our founders intended for free men and women. A free society, as created in America and unique for this idea, trusted its people to bear arms. This is not the case in the socialistic democracies, end quote, of Europe or totalitarian states like Russia, China, Nazi Germany, North Korea, Iran, or many others. In fact, each of the totalitarian states around the world, as soon as gun control and gun confiscation were enacted, those governments began slaughtering their citizens, millions of them in each of those countries. This focus on gun control since the tragic events in Newtown, Aurora, here in Tucson, and at Virginia Tech are really overlooking serious issues. We know that gun control laws alone don't work. Witness the high murder rate in Chicago, or Washington, or Baltimore, or Detroit, all of which have strict gun control laws. And we've also seen from authors such as the researcher John Lott, who has written an excellent book, More Guns, Less Crime, that areas with less restrictive gun laws actually have less crime than those areas that have more restrictive gun laws. And one of the things that we also see is the degree to which the common characteristic of shooters in recent tragedies have been young men who were seriously mentally ill, yet not recognized, not treated, and not properly listed in the national database as prohibited purchasers. That, to me, as a physician, is one of the biggest tragedies. Sandra Froman, a past president of the NRA and currently a practicing attorney in Tucson, Arizona, is my guest today for this discussion about the right to keep and bear arms and the government's focus on drastic increases in gun control, with the prohibition of most common handgun and precision rifles. Welcome to America's Fabric, Sandy.
Thank you, Lee. Thanks for having me on the show.
You are so welcome. Let's go to a question that I wanted to be sure and have you comment on. What do you think about the Vice President's recent suggestion that doctors should be used to ask patients whether they have guns in the home and how many and what type, and then evaluate those patients as to whether they are mentally stable enough to own a gun?
I think that that's really a horrible suggestion. I think it invades the patient's privacy. I think it harms the doctor-patient relationship. Talking to people across America, when I suggested to them that, how would you feel if your doctor asked you that, they're saying, I'd get a new doctor if I could. They say they don't want to be asked about things like that unless they raise it with the doctor as an issue of concern.
Well, I would absolutely agree with you as a physician. I think it turns the oath of Hippocrates on its head and absolutely destroys our role as healers. And it also makes physicians agents of the state. And
yes, it turns doctors into government spies, basically.
That's right.
When you combine that with the idea of the electronic database for your health records, it basically is a prelude to registration of guns. If doctors are writing down in your electronic health records everyone who has guns in the home, and not just do you have a gun, but how many guns do you have, and where do you keep them, and do your children have access to them, and things like that. I would be in favor, certainly, of a doctor giving a patient a piece of paper that says, here are potentially dangerous conditions in the home, especially if you have young children. Something on that list could be guns. Something on that list could be swimming pools. Something on that list could be, electric sockets at, low levels that aren't covered for infants. And that's where a doctor can give information to a patient. And then if the patient has questions, the patient can ask the doctor, how do I deal with this situation? But not to pry into people's personal lives.
Well, that's exactly right. There's a big difference between us as physicians providing preventive risk management information versus prying into what people do in the privacy of their homes. And we know that doctors were used in Nazi Germany to conduct medical experiments on Jews that were cruel and horrible, and certainly just a devastating misuse of the physician's skill. The Soviet Union misused psychiatrists to diagnose people as mentally ill to send them off to the gulag. So, in my view, physicians should revolt against being used by the government in a way that takes away patients' liberties.
It also, Lee, potentially creates criminals out of physicians who are attempting to fulfill their duties to their patients and to society. I mean, if a physician gets a directive that he or she must ask these questions and he feels it's not right and doesn't do that, the physician is potentially subject to discipline or a criminal law. I think that's just a bad idea.
Well, I think you're right, and I think more physicians don't realize that when they sign up to remain contracted with insurance companies and contracted with Medicare and contracted with Medicaid, they actually are exposing themselves to these types of regulations, which can jeopardize their license if they don't comply. What are a few common sense solutions that you think might actually help keep hands out of the hands of those who are so disturbed or who are criminals, and yet not infringe on the rights of law-abiding citizens under the Second Amendment?
Well, I think the focus has to be away from guns, which are inanimate objects and can't do anything unless they're actually wielded by people, and to the behavior of people. You know, we don't need to keep some guns out of all people's hands. We need to keep all guns out of some people's hands, those people being either criminals, hardened criminals who likely, if they commit a gun crime, it's not their first crime. And we need to keep guns out of the hands of people who are mentally ill and violent. Now, I'm not a physician, and not every person who's mentally ill is violent. But when you do know that people who are mentally ill have violent tendencies, we need to do everything we can to make sure those people don't get their hands on guns.
And Sandy, people may not realize that right here in Tucson, there were failures by both college officials and law enforcement to use the laws of Arizona properly to bring Jared Loughner to emergency mental health attention and screening, which, had he been properly screened when he was in the hands of people that should have reported how disturbed he was, we may have been able to get this young man treated before he killed people. And this is what disturbs me as a physician, that the emphasis is on the inanimate object and not on proper identification of severely disturbed young people. And we have the mechanisms in which to do that.
Lee, you are so right. Many people are not aware that there are laws in Tucson, in Arizona, that permit people who believe there is someone who is mentally ill and has violent tendencies, permit them to be reported to authorities, and for authorities to take steps to have that person evaluated, and if necessary, involuntarily held for treatment.
And actually, Arizona is more proactive in that sense than the 4 other states in which I'm licensed. Arizona is more flexible, and we really have better laws here to do just that, and yet they were not used in the case of Jared Loughner.
And also, just in terms of reporting information to the NICS, the National Instant Check System database, 23 states don't report mental health information to NICS. They either don't report it or they underreport it. And so even if there's been this clamor for something that the government calls universal background check, which I equate to universal gun registration. And they're clamoring for this, but there is no such thing as universal background checks because criminals aren't going to report. They aren't going to report when they steal a gun from a home. They aren't going to report when they buy a gun on the black market on the street. They aren't going to report when one of their family members gives them a gun, also a criminal. So the universal background checks are only going to apply to law-abiding, peaceable people. And there are millions and millions of them out there who have guns, who use them for entirely lawful purposes. And what the suggestion is to spend valuable law enforcement resources doing paperwork on the law-abiding, which criminals are never going to comply with. And if we have people who shouldn't have guns in their hands, whether they're criminals or the mentally ill, we need to get those names into the database, and then we need to enforce violations of those laws. President Biden said that the administration doesn't have time to prosecute people who lie on background checks. If they're not prosecuting people who lie on the forms now, why are more laws going to make a difference?
You're right, Sandy, and I so appreciate your being with us today. We are running out of time, but I greatly appreciate your insight and your addition to our program today.
Thank you, Lee.
Thank you. Wake up, America. Our American Revolution was the only revolution in history whose visionaries created a document that disempowered those who created it. Yet today, we see the government created by the people, for the people, using the people's tax dollars to whittle away our freedoms. Our American flag is not just a piece of fabric. It represents an idea about individual liberty that men and women have fought and died for, and has been a beacon for the rest of the world. The bottom line is that both healthcare control and gun control are in reality the flip sides of the coin called people control. Both were implemented in Nazi Germany and enabled the slaughter of 6 million Jews and others. Free men and women must protect our right to keep and bear arms. As Benjamin Franklin said, democracy is 2 wolves and a lamb voting on what to have for lunch. Liberty is a well-armed lamb contesting the vote. End quote. We live today in a society surrounded by wolves. We cannot defend our life, liberty, and property from the government wolves or criminal wolves by turning us all into disarmed lambs. It is time for free men and women to stand up for the principles that made America's fabric and made America great. This is Dr. Vliet signing off for today. Until next time, stay well and live free. For more on healthcare, go to patientpoweramerica.com or aapsonline.org.
You've been listening to America's Fabric, a radio series on American history and culture, broadcast every Sunday over KVOI Tucson and its affiliates. Be sure to tune in again next Sunday morning at 8. Until then, never forget, it's the courage, knowledge, hard work, and respect for truth of Americans that keeps America free and prosperous. America's Fabric is listener supported. To make a contribution, send a check to America's Fabric, Post Office Box 17356, Tucson, Arizona, 85731. That's P.O. Box 17356, Tucson, 85731. All contributions are tax exempt, and every contributor will be mailed a Grateful to be an American bumper sticker. To get more information on America's Fabric or to listen to previous broadcasts, go to americasfabric.com. That's americasfabric.com.